As the U.S. faces a dwindling supply of the monkeypox vaccine, the Biden administration is speeding up the delivery of the remaining supply by making an additional 1.8 million doses available. The additional shots will only be accessible to jurisdictions adopting the new method of administering 1/5 of the normal dosage per patient, and if the facility has used 90% of their current supply. Joining me now to break this down, Dr. Amber Moyn. She's an epidemiologist at UCLA, and she is an expert on monkeypox. She's been studying for 20 years, I should mention. So, Dr. Moyn, how much of an impact will an additional 1.8 million doses have on the demand for the monkeypox vaccine?
So, thank you so much for having me. Sorry, I have some noise in the background here.
No worries.
So, ask the question again. I'm so sorry.
Oh, yeah. So so how much of an impact will the 1.8 million vaccine doses have on the need for the vaccine?
Well, this increase in number of doses is going to be extremely useful. It's going to make a very big difference, but it's still not going to be enough. We need more doses of this vaccine. We need to get them out as soon as we possibly can, because the sooner that we can get in front of the ability for this virus to spread, the better off we're going to be.
So how do you get the vaccines to the communities that need them the most quickly? How does that actually happen?
Well, the best way to be able to do this is to be able to work through community organizations. Community organizations are going to be the best route to be able to make sure that the vaccines get administered in places where people really need them. So I think that making sure that people understand where they can go to get them, who is eligible, and the overall understanding of what the vaccines are going to be meant for, how much they're going to be able to protect people or not, is going to be critically important.
Where are we in the monkeypox pandemic or outbreak, if you will? Are we doing better than we were last week and the week before? Are we not doing better? Where do you see things?
Well, we're starting to see a decrease in the number of cases, but we don't know what this really means. There have been a slight decrease, but the cases are going to go up and down. It's just very clear that this is going to be a continuous process of really understanding. We may see dips in cases, we may see increases. It may move into different pockets of the population over time. So, I think it's really too early to say, except that, this is a problem that is certainly going to continue over the next several months at the very least, and very likely for much longer.
So one of the pieces of news today was Dr. Anthony Fauci announced he's stepping down at the end of this year as chief medical advisor to the president and head of the National Institute of Allergy and Infectious Diseases. In an interview with The Times, Fauci hinted that he wants to use this experience to inspire the younger generation. I mean, I'm like, is Dr. Fauci moving to the woods? Oh, should we go? No, I'm just kidding. So in terms of his role and importance at the National Institutes of Health and the future, speak to his legacy, but also how big of a vacuum they're going to have to fill in terms of leadership at the NIH.
Well, Dr. Fauci has been an incredible leader in the, not even prior to this pandemic. We have to remember that he has been a leader in the world of HIV, of infectious diseases, for decades. And so this is going to be a major change. We have a lot of really excellent people who are out there who, will have a lot more to give. We're lucky that we have a very strong infectious disease, a set of experts in the United States, people who are at NIH who will be able to step into this role, or in other places in the government. So I think it's going to be a very big loss to all of us, but he has set an incredible precedent for others, and I anticipate that he'll still be very active in providing a lot of advice going forward.
He's just a role model for me. Honestly, at the beginning of the pandemic, I was like, I'm not going outside without a mask until Dr. Fauci is outside without a mask. And until he is outside in a crowd without a mask, I am going to wear my mask. That's sort of how I've played this. Dr. Amber Moyn, thank you so much, as always, for helping us understand the latest. Please stay safe. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.